Hello, I'm Dr. Mridula, consultant obstetrician and gynecologist, laparoscopic surgeon and infertility specialist at Aster RV Hospitals, JP Nagar, Bangalore. Today, let us speak about something which is very common, something which all of us go through, all of us women, menstrual cycle and its irregularities. We will discuss this topic in terms of certain headings, like I don't want to go in depth into the physiology of it, but those key pertinent points like which is considered normal when and what is not considered abnormal, so that you have a reference to when to approach the doctor. So first is about onset of menstruation. So how early is too early, how late is too late. So anybody who gets a first menstrual cycle before the age of 9 years is considered as getting a premature menarche. It can be precocious puberty. You should seek help. And how long can you wait? Till 15 years, if somebody has not got her cycles, it is time that you visit your doctor, get your evaluation done to understand why the cycles are delayed. And provided you have achieved your menstrual cycle in the normal age group, that is between 10 years to 15 years of age. So when we obstetricians speak about menstrual cycle, it is in terms of frequency, that is how often the cycles come. Second is like duration of the cycle and the associated symptoms. So most commonly it is a 28-day cycle, but having said that, it is a range. Like everything in medicine, it is a range. 21 to 35 day cycles. Cycles can be as short as 21, as long as 35. Anything less than that or more than that, we need evaluation. Then the duration of the menstrual flow, how long should you bleed? So it is from 2 to 7 days is considered normal. And another thing is like what kind of blood. Clots in the menstrual blood is not normal. Menstrual blood is supposed to be fluid. If you are getting clots, that is also a point of concern. And see, for first 2-3 years of achieving menarche, that is the first time when you get periods, it is going to be irregular. Don't worry much if your cycles are too irregular during this period. But in 2 years, our brain becomes mature and we get into a rhythm. So the frequency of 21 to 35 days, lasting 2 to 7 days, and with no clots. Then as coming to associated symptoms, some amount of pain is normal, but usually it is self-limiting, not incapacitating you. It is not continuous. It comes in intervals and goes. But pain which starts before the cycle, during the cycle and lasts even after the cycle is not normal. Then another thing is like passage of big huge clothes, night changing of pads, and all these are abnormal. This needs to be evaluated. So to conclude, the red flag signs or those irregularities in menstruation when you should seek an obstetrician or gynecologist consultation is when you have not got your cycles even at 15 years of age, or if you have got your cycles before 9 years of age, you are having irregular cycles. That is like there is no fixed frequency at which it is happening. It is happening more than 35 days or happening very frequently. Or if you are passing like huge clots and the bleeding is lasting more than 7 days, or the bleeding is very less than 2 days, you should consult your doctor. Let us find out what is happening, and please come to Aster RV Hospitals, JP Nagar, Bangalore. Let us help you.